Pickleball. It is one of the fastest growing sports currently. And the question that a lot of patients have is after knee replacement, can you go back to playing pickleball? Hello and welcome back once again. I'm Adam Rosen and thanks again for tuning in. If you enjoy this content, click the thumbs up button and subscribe. It really helps people like you find content like this. And today I'm going to talk about pickleball and specifically pickleball after total knee replacement surgery. So if you look in our scientific literature and data, there's very little data to answer that question. This particular article from the Journal of the American Academy of Orthopedic Surgery said that really there's little to no data on pickleball after knee replacement surgery. But a lot of big institutions like Hospital for Special Surgery have articles, and they've noted that pickleball is easy for all ages to play, it's easy to learn, and you can socially engage with others. So it's a really important thing. And they've even talked about this in Journal of Arthroplasty. There was another article really asking the question, can I pickle after knee replacement? And the general answer is yes. Well, people always say, well, aren't there a lot of injuries? And yes, injuries can happen, but when we talk about the incidence, you have to kind of look at the big picture as far as statistics. Now, many people don't know that many years ago, I used to be a big skydiver and I made a lot of jumps, over 5,000 skydives, and I stopped keeping count. When you hear about someone dying skydiving, everybody thinks, oh my God, that's the most dangerous sport in the world. Well, I looked back, and in 2024, the death incidence was 0.27 for every 100,000 skydives. So your chance of dying is less than 1 in 370,000 skydives. And last year, there were over 3.8 million skydives. So there are a lot of skydives. And the same thing holds true for pickleball. When lots of people are playing pickleball and there are injuries, people think that the sport is really dangerous. It's more of an effect of there are lots of people playing pickleball for many, many hours each week. And studies have looked at this huge growth in the sport, and they found between 2020 and 2022, the participation increased over 158%. So that is a lot of people playing pickleball. Now, again, there's not much data, but there's a little bit more data on tennis. And I'll be honest with you, the data is not great. This article from the Journal of the American Academy of Orthopedic Surgery found that there are more acute injuries in the lower extremity. So Achilles tendon ruptures, quad and patellar tendon ruptures, falls that result in hip fractures, while there are more chronic injuries in the upper extremity, things like tennis elbow and rotator cuff problems. Serving in tennis was the most forceful thing on the body. And luckily, the serve in pickleball is a lot less demanding. So we would assume that there will be less injuries from serving playing pickleball as opposed to playing tennis. The other thing that people found is that when people are playing tennis after knee replacement, what do the doctors say? And what this one study found is that only 21% of surgeons polled approved of their patients playing tennis after knee replacement surgery. And of those polled and approving tennis, 45% of them recommended that patients only play doubles. Now, some of this goes way back to the original rules for patients after knee replacement surgery designed by the Knee Society. And there were lots of weird rules without much scientific data. And that was one of them, was that you can play tennis, but you should only play doubles tennis. And no one's really sure, because I have a lot of competitive tennis players that go back to playing singles, and they can do it, especially if they were doing it leading up to their knee replacement. If you haven't played tennis in 10 years, don't expect to get back to singles tennis after having a knee replacement, because your body will not be able to accommodate the movement and the strength and the force and the timing that is required. But if you choose to have a knee replacement, and if you enjoy playing pickleball, what I always tell my patients is go back and play. Spend time with your friends, but be smart about it. So for many, many sports, what I always recommend is you have to make sure that you're recovered enough to go back and do it. Every patient's going to be different. If you feel good enough to go back and play pickleball, go out with a friend. Don't play a match. Just volley back and forth. Have a conversation. Hit the ball over the net. If it's more than a foot or so away from you, let it go. And if you do that a couple times a week, couple weeks in a row, you build up your strength, you build up your stamina, you build up your coordination, then you might go out and have a casual game with friends. And again, if someone lobs it over the net, don't go diving for it. You just had a knee replacement. And if the ball's far off, let it go. It's okay if you lose. But as you get better and you start to get more confidence and you start to build more strength and you start to build more stamina, you might find that you can be more and more competitive. But you want to listen to your body. Don't overdo it and be cautious. Because again, if you trip and fall, you can break your hip as well as hurt your knee, as well as hurt your Achilles. You can fall and break your wrist. So, with any activity, there are always risks. But the benefit of physical exercise and the benefit of social interaction is a significant benefit for many older individuals. So, I really hope this information at least just helps you a little bit. Again, I don't have all the answers because scientifically we don't have the answers. Maybe in 5 or 10 years we'll have more data that will better answer these questions. But if you enjoy pickleball or you're thinking about taking up the sport after knee replacement, reasonable thing to do. But as always, check with your physical therapist, check with your surgeon, and make sure that they're in agreement with you getting back on the court. Until next time, I'm Adam Rosen. Stay safe.